If a student is getting to this level of care, it is because they have not been able to be successful at lower levels of care. That can be multiple ER visits, it can be inpatient, it can be intensive outpatient, and for safety reasons, need to come to a campus like ours where they have time and safety and can get to the underlying issues that are causing their behaviors. So for some of our students, those behaviors might be self-harm, suicidal ideation, running away, refusing school, drug use. A large part of them have trauma in their history. The bottom line is these kids are complex, so they need to come where there's a team that can handle the complexity and the acuteness of the behaviors that have been happening.
When you compare outpatient therapy, even intensive outpatient therapy, we are on the upper cusp of those things, right? We are a full residential program where students and teens with chronic mental health come and live 9 to 12 months with us and try and get their life back on track and get life a little bit more manageable so that they could return to a home environment. With that, there's a certain level of acuity that we work with that require things like staff trainings around safety, therapeutic holds, interventions that might seem intense to people who don't understand chronic mental health, right? But when we look at where we're at on the spectrum, we're a few notches down from a psychiatric hospital. And so this is a less restrictive environment. A lot of the kids that we see have been in and out of different psychiatric hospitals over and over. They got to such a chronic point that their life was kind of passing them by, and so there needs to be an intervention put in place that allows them to focus on therapy and has a structure that allows them to do so safely. And so there are things and lengths that we have to take in order to keep our clients safe, and some of that include things like having certain doors locked or having certain staff ratios that are higher than other programs, or having our gated community area. By the time students get to Elevations, this isn't just outpatient therapy. They're not just seeing a therapist because they're feeling a little bit nervous when they go to school, or they had a relative pass away and they're just working through some of the grieving stages. By the time students get to Elevations, they're working through chronic traumas, anxiety that's been crippling for several years, depressive episodes that are incredibly intense. They're not being able to participate in activities of daily living that they were able to previously. They're at a more chronic level and need more supports and more structure than most other avenues.
Because we work with such a wide range of individuals, that means we have a wide range of needs, right? And so we have the ability to enforce these interventions so we can meet the needs of, student A over here who is currently having suicidal ideation, right? And then we have an ability to decrease certain interventions for kid A who that's not their struggle, So we might have a kid come in and on week 3, they're able to courtyard, which means they can go into the courtyard. They don't need supervision. They can walk back and forth from buildings because that's their treatment plan and they don't need that level of supervision. And then we might have another student who isn't able to have that until, month 2 or whatever, right? And so it's necessary because we do work with some high-risk populations, but I also appreciate that there are ways that we can decrease some of those interventions because not every student needs it. But when we do need it, when our students are in crises, we have the ability to access it.
I think parents do exhaust a lot of avenues and they kind of just are at the wit's end of, how do I help my child? It's scary. So I honestly, talking to a parent, I would, what does your heart tell you? And you're doing this for your child. You're not disconnecting from your child or looking for a babysitter. You're truly at your wit's end and you're in fear of your child's life. And that's where we do come in because we do save lives.